Good afternoon, and thank you for joining us. I'd like to begin by saying that collectively, our message to Mainers today is that during this pandemic, we have all had your backs, and now we need you to have ours. We're about 9 months into this journey with COVID-19, and all of us in healthcare feel the same as you do. We are tired of this. However, today, we are here to tell you that as healthcare workers, we need your help. Up to this point, Maine has been fortunate compared to other states. But the fact is that currently we are seeing the highest number of cases, hospitalizations, and deaths since the pandemic began. Here are today's updated COVID-19 numbers from Northern Light Health. We have a total of 52 patients that we are actively caring for. 41 of those are hospitalized in one of our facilities. Eastern Maine Medical Center has 16 patients. Mercy Hospital has 12. A.R. Gould 1. Blue Hill Hospital 3. Maine Coast Hospital 3. Sebastopol Valley Hospital 4, Inland Hospital 2, and our home care and hospice team are currently taking care of 11 individuals at their homes infected with COVID-19. So you can see numbers are rising and they're widespread. As healthcare workers, our pledge to you is that we come to work every day and give our best in order to keep you and your family safe and healthy. But we need your help so we can continue caring for all patients in need. You have the power to slow the spread, reduce hospitalizations, and prevent more deaths from COVID-19. Right now, some of our hospitals are beginning to implement their surge plans. We've been preparing for this for months, and we're ready. But the increase in cases makes our caregivers' jobs that much more difficult, and it affects everyone. By simply taking the right precautions all the time, we'll all save lives and reduce the burden to our hospitals. That's why Central Maine Healthcare, Maine General Health, and Northern Light Health are choosing to work together to spread the word. Together, we want to help every Mainer understand that this is serious, but each of us has the power to make a difference. You'll see the messages we share today in newspapers and news websites ads across the state, and we'll be spreading the word on social media for the rest of the holiday season. Now I'd like to turn it over to Dr. Alexander to talk more about what we're asking from Mainers.
Thank you, Dr. Jarvis. My name is John Alexander. I'm the Chief Medical Officer at Central Maine Healthcare. Thank you all for joining us today about this timely discussion that we're having with you and the people of Maine about the coronavirus and where we stand. I'd like to begin by sharing our current situation at Central Maine Healthcare. First, our incident command has been meeting daily to review our staffing, our census, our surge plan, all of our supplies and equipment in order to ensure that we have everything we need to care for our community. As Dr. Jarvis mentioned, we are preparing for a surge and have what we need, at least at the outset of a surge, in order to take care of our community. We currently have 15 hospitalized COVID patients, one of whom is on a ventilator. We've seen our test positivity rate increase from 5.9% the previous 2 weeks to 6.7% these past 2 weeks. And we've been averaging anywhere from 150 to 250 people tested per day during our weekdays. However, our operating rooms, our testing and treatment areas, and our clinics continue to run at full capacity in order to meet the needs of our community. I've been so honored to work with a dedicated team of caregivers in our hospitals, doctors' offices, and health clinics at Central Maine Healthcare. I've heard their stories about living and sleeping in separate areas from their families in order to keep their families and their coworkers safe. While cases are up across the state, there is some good news to share. As you've heard, the first vaccines will begin to roll out over the next few weeks. And although supply will be very limited at first, more doses will follow in 2021. Each of our health systems, Northern Lights, Maine General, Maine Health, and Central Maine Health, have all been coordinating over the past several months with the state and the CDC to ensure timely and effective delivery of the vaccine to both our healthcare workers and our communities. In addition, we've seen our treatment options expanding, giving us more tools to use in the fight against COVID-19. But despite all of this good news, we know that the coming weeks and months could be devastating for Maine families and more challenging than ever for healthcare workers. We set new records for positive cases each week, and our Mainers in our communities, including those very healthcare givers that provide services in each of our hospitals and clinics, are physically, emotionally, and socially drained. That's why today we're asking you to do some simple things that we know will make a difference. Something that you can do to support all the women and the men on the front lines who provide healthcare, food, and services to you and your family. The first is wear a mask. It's simple, you've heard it for months, but it's something that can be done and really makes a profound difference in the spread of the coronavirus. You should have a mask or face covering on anytime you're inside and anytime you're in public. No, you don't need to wear a mask when you're around immediate household contacts unless someone in your house has symptoms or has been identified as having had exposure to the virus. But wearing a mask is your first and best defense against spread or catching the coronavirus. Second, hand washing and cleaning services with bleach or sanitizing. We need to be vigilant. Frequent hand washing and regular cleaning is an important safeguard to prevent spread of infection. Whether you sing happy birthday, Santa Claus is coming to town, or some other favorite song, remember to spend enough time sanitizing your hands to get in between your fingers, your palms, and your knuckles. Thank you again for joining us to receive information about what we can do to make a difference during this pandemic. Wearing a mask and washing your hands will help keep you and your family healthy and our most vulnerable community members out of the hospital. It's also a great way to show that you stand with the caregivers at your local hospital and doctor's offices whose jobs are becoming more challenging as cases rise. To share a couple of additional actions, I'd like to turn things over to Dr. Diaz.
Thank you, Dr. Alexander, and thanks to the media for being here today to help us spread the message. We appreciate your help in covering this today, and my name is Steve Diaz. I'm the Chief Medical Officer of Maine General Health. At Maine General, here's our current situation. We have 18 inpatients with COVID, 4 in the critical care unit, and 1 on a ventilator. In Kennebec County, the 14-day case rate, which is the number of people per 10,000, is currently 20. About a month ago, we broke the 8 per 10,000 barrier, which moved us from low to moderate community spread. Because of that, we've had to take other actions. We also have plenty of personal protective equipment right now. We have plenty of beds, and we can deploy our staff to help meet critical need areas. And as Mainers, overall, we've done a really good job in mitigating the spread of COVID-19 over the past few months, and we should all be commended for that. But unfortunately, as the spread of the virus has picked up nationally, it's also picked up here in Maine. We're Mainers too, just like you, and we know it's practically in our DNA that no matter what, we go to work. You have a little sniffle, you have a cough. Well, the rules are different. Coronavirus is all around you, so we all have to be very vigilant. If you have symptoms and it may be a spreader, we need you to stay home. The other part is it's the holiday season, and it's natural for family and friends to come together for all the right reasons. But this year, we were asking you to be more thoughtful and maybe change your approach. We all want to see loved ones. We all want to get together, do some socializing. But we're asking Mainers over this holiday season to do things a little bit differently. Please avoid having multiple households gather under one roof for the holidays. Always wear your mask if you are gathering, and be sure to stay 6 feet apart. And outside is better, although it's a bit cold today. And make sure that children are masking up as well. And we recognize it's a real sacrifice to approach the holidays this way, but it's a sacrifice that could save a life. We get it, it's not easy, but there are ways to make the best of it, and perhaps consider starting a new tradition. Maybe Zooming is a new thing you do, or maybe you do projects or think of giving things that you can mail out so that you connect with people in different ways of making memories. Finally, if you do get sick or have COVID or have concerns or other medical issues, know that your local healthcare organizations are there for you. We are here to help you no matter what the issue is, and we can only continue this way if all of us are doing things to stay safe. You can feel confident visiting your hospital or healthcare provider for any needs because we're taking the actions that are appropriate to keep you safe while you see us. As Dr. Jarvis mentioned today, this is the beginning of a conversation that our healthcare systems are having with communities that will continue through the holidays. Ultimately, our message is that we're not giving up on Mainers, and we need Mainers not to join the fight. We can do this together. The other important piece here is that these are very stressful times. Patience and kindness will go a long way, and we're asking you to change. We're asking you to be more vigilant of your own personal habits, and also recognize other people have the same stressors as we're asking them to change as well. So with that, we'll now take questions. I'll turn it over to Chris to coordinate the question and answer portion of the news conference. Thank you very much.
Great. Thank you very much, Dr. Diaz, Dr. Alexander, Dr. Jarvis. Now we'll move on to your questions from the media. And there's a fairly, just a fair warning, there's a fairly robust group of people in this in here. So it might take me a minute or two to find you and unmute you. Wait until you're unmuted, and then you can ask your question. And we're going to start again with Patty White from Maine Public. Patty, looks like you're unmuted. Please ask your questions. And let us know who you're directing it to as well.
Oh, sure. This question, I guess, is for anyone who wants to answer it. Thank you very much. So your hospitals are at different stages of either implementing surge plans or ready to implement them. If things keep going at the pace we're at, do you have projections for when those changes you have to make are going to be kind of a breaking point, are going to mark a big shift in how you operate? Like if things keep going on this path, like when are things going to become really problematic for hospitals in terms of dealing with patients?
So I'll start. Patty, that's an excellent question about, when is it that we're going to see trouble because of the number of patients that we're seeing. I would say that we're already there in terms of the fact that we could actually be lessening the number of patients if we were all doing the things that we were supposed to do. And our job really is to get to a point where we're not talking about this increase in hospitalizations and deaths. We want to be talking about good news. But each of us struggle with this every single day. If you look at just Eastern Maine Medical Center, our overall numbers have gone up and down since the week before Thanksgiving until this week on a fairly regular basis. So that means we are going up and down on our surge plans each and every day to meet the needs of our communities and meet the needs of our patients who are coming in for access of care. And that's what you're seeing as a collaborative effort across the state between all of the major health systems, the Maine CDC, as well as our independent hospitals and other health organizations. We are monitoring this basically going on a day-to-day basis. There are some dire predictions that by Christmas time, we will be overwhelmed in our hospitals. We don't want to see that happen. And that's the reason why we're getting this message out today. Every one of your listeners, readers, and other people that you're reaching out to can make a difference by doing the things that we're asking them. Wear a mask, wash your hands, don't go out in gatherings, and just look out for one another.
Just to follow up on that briefly, Pat, there's not one metric that's the trigger for the threshold. So personal protective equipment, having enough beds, having enough staff, everything is a dashboard that I think we all look at daily in our incident command. So there's not one way to say that when does a plan escalate. It's that many of us are already using plans in part based upon what part of the dashboard shows that we might have some, might need some help or redeployment or other strategies to help us stay whole. So it's a great question. It's many different parts.
And I would just add, first I'll just say we're not going to, I promise we're all not going to try to answer every question, but I would just add one thing. Dr. Diaz mentioned that it's really important for those of you in the community who require healthcare services, whether it's primary care health, mental health, a surgical procedure, it's really important for you to continue to seek that access. And one of the differences that we have pursued, each of our systems have pursued during this period of time with our surge plan, is to make sure we continue to have that critical capacity for screening examinations, for surgeries that might be necessary, for clinic visits, things along those lines. So the surge plan, as Dr. Diaz mentioned, the triggers are pretty complex, but we're working very diligently to make sure that all of you have access to come in and get the care that you need in a timely manner, unlike what we saw happen in March and April, where we really saw a shutdown of a lot of elective services.
Patty, do you have a follow-up question?
I do, actually. Thanks so much. We're looking at potentially vaccines arriving in Maine in a couple weeks if things go well, or maybe even before that. How does the surge in patients affect your ability to administer vaccines? Is that a concern?
I don't think it's a concern. All of us are very skilled in doing vaccinations and mass vaccinations. We did not skip a beat this year with our influenza vaccine, our flu shots. We were able to respond both to our staff as well as our patients and the communities. So I don't foresee that as being a challenge we will not be able to overcome. We will consider that to be one of our number one priorities.
And Dr. Diaz and Alexander, are you all set? Just so you can nod if you don't have anything to add. Okay, good.
Yeah, agreed.
I'm going to move on now. It's going to be WABI, and I believe I can find you in the list here. Owen Kingsley. Owen, as soon as you're unmuted, please state your question and who you'd like it to direct it to.
Thank you. I'll direct this to Dr. Alexander. Also going off of vaccines, are there any concerns or nerves among healthcare workers being the first mass group of people to try out this brand new vaccine?
It's a great question. I think there's been a lot of discussion around that, both internally, obviously externally, and in the media. We've had the fortune, I'll say fortune, to see, the vaccine begin to be rolled out in the United Kingdom just this week. We've looked and we've asked our healthcare providers across our system and across different specialties and departments to understand what they need to know in order to make the best informed decision about the vaccine. We're roughly about 50 to 60% of our healthcare workers say they're interested in the vaccine, and they've given us outlines of what they want information about. What are the potential side effects? What happens if I have symptoms as a result of the vaccine? How does that impact me in terms of my ability to continue to work, or do I have to spend time away from work? So we feel like we'll have enough information, and we've maintained a transparent process with our team members in order to ensure that they can make that decision for themselves. And I believe they'll make a good decision around accepting the vaccine.
Okay, thank you very much, Dr. Alexander. And I'm sorry, I muted your mic, but let me get back to you. And if you have a follow-up question, please.
Yeah, just one. How well are you? You brought up the concerns that healthcare workers bring up. How well, I mean, considering how new this is, how well are you able to answer those questions and concerns of theirs?
Well, and I'll certainly defer or look to my colleagues to fill in some information as well. We're being provided the information that in large part is being provided out into both the media as well as to the scientific community. We've had a chance here in the state of Maine. Our Maine CDC and our Department of Health and Human Services have done a great job of making sure that the manufacturers of the current vaccines, Moderna and Pfizer, have been providing us with as much information as is available, including results from those studies. So again, it's a transparent process. We're seeing as much information as we possibly can to understand who's receiving the vaccine, what the profile of individual looks like, what those side effects are. And so, it's as much information as we have available. And I think that's one of the challenges that we've dealt with all along with this pandemic. We talked about this early on over the course of the pandemic. This was something new that we didn't necessarily understand, and we've learned as we've gone. So, we've built a certain level of trust with each other and with our caregivers, and that's what we're relying on to be able to make sure that we can answer their questions honestly and that they can make an informed decision.
I would add, John, the only other thing is that the FDA has not yet formally issued the emergency use authorization. And typically when they do that, they also provide lots of information about perhaps a toolkit would be a good way to frame it, of the paperwork that people provide in order to give people informed consent around a vaccination. So that will come out also over the next week or two. Pfizer probably tomorrow, and then Moderna to follow soon after.
Okay, thank you very much for your questions, Owen. I do not see a representative next for the Kennebec Journal Morning Sentinel. If there is someone in the room I'm missing, please speak up in the chat window and let us know, and we'll get to you. But next on the list, I see Rosalind Flaherty from Center, Maine. Rosalind, when your mic is unmuted, please ask your questions. Sorry, it's a little sticky, Rosalind. Give me a second. Erin and Candy, can you try to?
Can you hear me? I'm sorry.
Rosalind, yes, we can hear you. Great.
Okay. You guys touched on this a little bit, but what exactly are you hearing from doctors and nurses? And is anyone having any staffing issues?
Is that directed to someone in specific, Rosalind? Okay. Any one of you want to field that?
So I think
Anyway, it's basically for everyone.
Okay.
Thanks, Rosalind. We all face staffing challenges. Healthcare workers are just like everybody else. We still need to go out into the community to do essential things like get groceries, buy gasoline, and the like. And so we have also felt the effects of COVID-19 amongst our staff. Right now, for Northern Light Health, we feel that we are meeting the challenges that we need to. And part of this campaign really is to help protect our healthcare workers so that we don't see staffing shortages in a way that would make it so that we need to curtail any service. We want to remain open with both our acute care and our elective primary care and chronic illness management so that we can continue to serve you well. And that's really what we're seeing here. So no widespread shortages at this time, but it is a concern of ours that we need to monitor on a regular basis.
Just want to pick up on that. So I do think staffing is tight, though. I think because all of us have some staff out already, either with COVID or because they're close contacts. The other thing that plays into this is childcare has been very challenging with schools having variations on how they're open or if they're open. So I do think staffing at all levels is tight. I do think, though, one of the messages that we're coming together today to say is that we are happy to meet this head on and do all we can and continue to build our resiliency and collegiality. And we hope that that will last for a long time. But given the fact that our numbers are increasing and that we are so tight on staffing with little residual capacity, we need people to do their part, the community at large, on making good decisions about how they continue to protect themselves and their families and thus protect us as well.
Yeah, and I'll just say the one thing I would just add is that, so for example, we've been monitoring on a daily basis how many of our team members system-wide are out, either because they tested positive or they're quarantined due to an exposure. The vast majority of those exposures are community-based exposures. And just as a reminder to all of you, when a healthcare worker has to stay out of work, that presents a little bit of an emotional crisis for that individual, right? People who come to work in a healthcare setting do so because they want to take care of patients. They do so because they want to take care of our community. And so them staying out is a sacrifice in and of itself. We've asked them, and we continue to ask them, that if they have any symptoms, that they really stay home until we can either verify through a test or some other methodology that they don't have COVID. But it is important to recognize that one of the reasons we need the community's help with tamping down the spread of COVID is because we want those healthcare workers to be able to come symptom-free into the workplace and make sure that they can provide care as needed.
And Rosalind, do you have a follow-up question?
Nope, that's it. Thank you.
All right, thank you very much. Okay, next up is going to be Lindsay Tice with the Lewiston Sun Journal. Again, Lindsay, whoever your question is directed at, and wait until you are unmuted and then ask your question.
Hi, everyone. Thanks for taking the time. This is for anybody who wants to answer it. What prompted these three organizations to get together? It's unusual for different hospital systems to speak in one voice. It's highly unusual for them to send out a joint letter like you guys have done today. What prompted the three of you to get together in particular?
I'll start. The three of us actually get together on a regular basis. And I think that's part of what the message that we want to give out there to Mainers. We are so lucky to live in a state where, despite people would call us competitors, we don't see each other that way. We see each other as collaborators, and that we are all play an integral role to keeping Mainers safe. The impetus for this particular project that we're undergoing right now was really because we are seeing alarming increases in the number of cases across the state. It is no longer confined to our more urban areas. We are seeing rural communities devastated by this disease, and we are seeing families who have to mourn loved ones that really should not have happened if we had all followed the rules and guidance that we were given very early in the pandemic. And so with that said, we feel it's necessary for us to come together to show that, one, we work together, that we are here for the benefit of all Mainers, and to ask for Maine's help.
Just to follow up, so as physician and clinical leaders, even before the pandemic, we would collaborate. We have an email listserv. We ask each other questions. It's a different level. And then with the pandemic, we've been, as Dr. Jarvis said, we've been meeting weekly at least, if not many of us on the same different committees, talking all the time. I don't think, another way to look at it is, I don't think you could say that there's any hospital in Maine that if it were to not exist right now, that we'd all be better off, or the community would be better off. So we come together because we realize people need to hear from us that we are at a tipping point as far as the increases is going, as far as the increases that we're seeing are going, and that we really need everyone to work together as we are, thus the common message that you're hearing today.
And Lindsay, do you have a follow-up question you'd like to ask? If so, when your microphone is unmuted, please go ahead.
Great. If you guys could wave a magic wand, what would be the one thing you would want folks to do? Is it masks? Is it, staying away from each other at the holidays? Is it really just, please, God, do everything you can because we're in a crisis situation here, or we're afraid we're going to be?
So
I'll start. Oh, sorry. Go ahead, Dr.
John, you take it.
Okay. Well, I would say it's do everything that you can. There's not one method or one tactic that you can take to prevent yourself or others from either contracting coronavirus or spreading coronavirus. One of the approaches that we all have taken in all of our healthcare facilities, in our clinics and our offices, is to really look at every single thing that we can do, whether it's plexiglass dividers between our staff members and patients in the waiting room, removing chairs from those waiting areas, deep cleaning of our ORs and our clinical care areas, obviously masking, eye protection, those sorts of things. So this really has to be about implementing as many effective measures as possible. And so that's what we're asking everyone to do.
Thank you very much,
Not
Doctor.
to think for yourself, but to think about everyone else and everyone around you. We need to put everyone else first at this time because that's how we will get through this. Think of your relatives who are over age 65, who have cancer, diabetes, are obese, young children, pregnant women, healthcare workers, military, first responders, police officers, or anyone in between. You want to protect each and every one of those. So let's think globally now. Let's think about everyone else, and then we will all get through this.
Okay, thank you very much, Dr. Jarvis. Next up, we're going to move on to WMTW. Ross, once you see that your microphone is unmuted, please feel free to ask your questions. And again, let us know who you'd like to direct it to.
Hi there. You guys able to hear me okay?
Loud and clear.
Thank you. So you've used the words dire and crisis, and the trend certainly going in the wrong direction. I'm curious if any of you would be able to paint a picture of, if this trend continues on the line that we're on, what the coming weeks and months might look like in Maine. Not really speaking in generalities, but specifically, what are some of those big, jumping off points that we're heading towards?
I'd rather talk about what we don't want to see. We don't want to see us a return to what we did in the spring, where we cut back on elective surgeries, where we closed our ambulatory care units, making it so that our ambulatory offices, so that people were not able to access us for routine health care, that we stopped preventative things like mammograms and colonoscopies and things that we know will save lives. We don't want to go to that. We don't want to see that. We also don't want to see what's happened in other places of the country, where right now they are building external hospitals, but don't have staff to staff them, and therefore patients aren't being cared for. We don't want to see loads of patients that are literally dying in our hospitals. We don't want to see any of those things. That's what we're scared of. That's why we're here, because we want to prevent that from happening. Maine has done an excellent job, and we need to continue doing those things, and we need to do them better.
And on the heels of that, so back when we suppressed healthcare back in March and April, I think you'll see a study coming out probably next summer showing that the amount of people who stayed home with their elevated blood sugars, with their chest pain, with their shortness of breath, was way beyond what was safe, and that people's progression of disease, both morbidity and mortality, spiked June and July. And again, I don't have a formal study showing that, but I think you'll see that coming out because we all felt that. So the real dire part is, if we have to, again, not be able to do those things because it's too dangerous as far as spread goes, we're going to see another spike in diseases that require chronic management and or acute management that people are not seeking due to their fears. which overall impacts the whole community's both access and then of course, the mortality data for that community. It's hard to explain how that could happen, thinking what we know now, but it's not so hard to think about that if we have our beds filled with people who have COVID and then our staff have the same incidence of disease. You can see how those intersecting lines are going to put us in a position where, again, where you have to pull things back. We do not want to do that. It's not safe. It's not healthy. And so to me, as Dr. Jarvis was painting, that really is dire.
Thank you, Dr. Diaz. Ross, do you have a follow-up question to ask? If so, wait again till you're unmuted.
I suppose I would just ask, as a matter of public policy, whether it's at a local level or a state level, is there anything that you would like to see introduced to prevent us from getting there?
I'll try to answer that question for you. I think when we entered into when we had the spring and we had to go into a period of what most people think of as lockdown, when we had closures of stores, restaurants, other public facilities, we also saw that we had closures of the ability for the public to be able to visit their loved ones in long-term care facilities. And as a reminder, a long-term care facility for many people is their home. It's not a short-term period of time where they're recovering. It's where they now live. We did the same thing with our hospitals as well. And I think all of us on this panel had to make the very difficult decision sometimes to say no to having a loved one visit someone who was in the hospital and was in a condition where they really needed some emotional support. So, we are trying to ask people voluntarily to, utilize the guidance that the CDC has provided to us around hand hygiene, remaining distanced, and mask wearing. And really beyond that, if we can all participate in that process, we don't need to look at stricter measures that would then require either closures of businesses or other, other initiatives.
Okay, thank you very much for those questions, Ross. I will move down the list now, and next up is TJ Tremble from Fox Bangor, TV7. Again, you know the drill, TJ. Once your mic is unmuted, please feel free to ask your questions. I know you're on there, TJ. I just got to find you. If any of my facilitators who are out there can help me find TJ.
He may have dropped off.
Okay, yeah, I don't see him, so I think maybe he's gone. Okay, well, let's move down the list then. Kevin Miller from Portland Press Herald. Give me a second to find you, Kevin, and then we'll let you ask your questions.
Great. Yeah, thank you very much. This first question, I guess, would go for any of you. The Maine CDC, as you guys know, announced yesterday they're not going to be conducting as much testing for COVID-19 as they kind of prioritize their own testing. Did this announcement today have anything to do with that, or can you talk just generally about your own respective testing capacities and whether you have concerns about your ability to keep up with that if we see additional surges?
So I'll start.
Yep.
This had nothing to do with that particular announcement. This had been in the works already. As we said, this is really in response to increased case numbers. I will say it's not that the state is going to decrease their testing capacity. It's just simply that they are being overwhelmed because of the sheer volume of cases that are going in, and they really need to focus in on outbreaks and making sure they are testing individuals in areas where outbreaks occur. And so we support that as being part of the decision. Is it sad news for the state of Maine? Absolutely. Any loss of us in any kind of resource is a major blow to the state, and testing is such a critical part of what we do. At Northern Light, we will continue to ensure that we have capacity to test people in clinical situations where we think testing will help facilitate care, and so that will be our #1 priority. And then we will need to prioritize for those people who are doing things like asymptomatic testing for travel, return to work, and things like that. We will have to prioritize those, and that's the situation that we have been in really since this pandemic began, and it's just becoming worse now because of those increasing case numbers.
And do you have a follow-up question?
Yeah, thank you very much. And this is, I guess, more general. I mean, a lot of the things that you're asking Mainers to do right now, wear masks, wash your hands, are things that you in the public health, as well as the governor and the Maine CDC, have been asking people to do for months now. I guess it again, more philosophical. I mean, it is what more needs to happen in your eyes to kind of get that message through to people, especially as we come up to the holidays, where it seems like, as Dr. Shaw has told us, these aren't necessarily outbreaks that are happening. It's community spread, and it's small gatherings where a lot of this transmission is happening. So, yeah, again, more philosophical questions. We've been hearing these messages forever. I guess what more needs to happen to get through to people?
So I don't think it's philosophical. So I think there's been some splitting of messaging that has occurred that has created these different camps of opinion. And it's we're coming together to say there is no different camps of opinion. Dr. Alexander said it very well. All the strategies in concert will help slow things down, but not one individual thing does it. But I would hearken to a specific example of face coverings or masking. We know that is the best way to cover your face, your nose and mouth, to mitigate spread and perhaps even potentially mitigate the ability for you to bring something in. Anything else falls short of being successful. Yet we see many people either not masking still or wearing other type of devices that aren't really sanctioned and are woefully inadequate. Sometimes they have to, maybe they can't wear a face mask for whatever reason, so they have to default to something less constrictive. Yet it seems to be way out of proportion to who should qualify for that. So behavioral changes are the hardest things to help people with in medicine. Giving somebody a pill is relatively easy to giving them behavioral messaging. So we are hoping that collectively the behavioral messaging we're giving, which is really solidifying the ongoing public health message, might gain some traction here. And given that it's between the Thanksgiving and Christmas holidays, knowing that this is more important now than ever, that maybe people will have a cause to listen and really understand that this is not a disparate discussion or recommendation. We are saying this is what we have to do. There isn't an option B. Option A of all these things is the only thing that's going to help. I think that's the difference.
Okay, thank you very much, Dr. Diaz. Thank you for your questions, Kevin. I will move next, and I believe we have Taylor from WGME. Again, Taylor, once you see that your mic is unmuted, feel free to ask your questions. And if you have someone in specific in mind, please direct your question at them.
Good afternoon. This question is for anyone who feels like answering it. Just thoughts on vaccine distribution. After healthcare workers and first responders, how should the state prioritize what groups get the vaccine first?
I think the high-risk populations, we've seen in our history already in the last year that those who are in congregate living facilities, either long-term care, prisons, or other, might be higher risk and have worse outcomes than others. So I think the next group is those in congregate living, especially in long-term care, nursing facilities, skilled nursing facilities. The other way to look at that is if those groups really are blossoming, that if someone gets sick there, then it spreads to 50 people almost overnight, that those are also the types of outbreaks where, because they have perhaps more chronic medical conditions, that they need hospital services as well. Yep. So if you can make an impact there, that would probably be the best thing we could do as a community to help our resources stretch further and help the acute care hospitals not get to a stretching point. But that would be my 2 cents on that question.
And Taylor, do you have a follow-up question?
I don't. Thank you.
Okay, thank you very much. And I do see, last but not least on our list is Charlie from Bangor Daily News. Charlie, just give me a second to find you, and then we'll unmute you and let you ask your question.
Yep. Hi. Thanks everyone for holding this session today. I've heard kind of secondhand, I think, and specifically, I think it was about Eastern Maine Medical Center that people who directly, healthcare workers who directly work with COVID patients in the COVID units wear N95 masks at this point, but that other workers, and part of the question is just if you could confirm this or, clarify if any of it's wrong, that, people who see patients outside those units just wear regular surgical masks and maybe face shields as well. And I thought I heard at one point early on that all the frontline workers there were wearing N95. So I guess I'm wondering if that's changed at at each of your hospitals, and what has driven that? Is it just a supply issue, or is there some more, medical guideline that justifies doing that?
With the fact that you addressed Eastern Maine Medical Center, I'll start. So the guidance that we follow is the same guidance that the federal CDC recommends. And so for quite some time now, all of our healthcare workers in any of our institutions have been wearing face masks that are hospital grade face masks, and we continue to do that. We added the addition of protective eyewear at the same time when they are interacting with any patient, regardless of COVID status. You are correct that we take even more precautions for those individuals who are COVID positive for a myriad of reasons. We know that they have the disease, and the disease can be spread. But the guidance that we are following has proven to be has served us very well. We have very few cases across all of Northern Light, and in fact across the state of Maine, of healthcare workers who have contracted the virus while at work. The measures that we put in place not only protect us, but they protect our patients and the visitors that we allow into our facilities. So what we are doing right now is the appropriate thing to do. We have been fortunate that we have been able to keep up on personal protective equipment in order to provide that and be safe for everyone.
Okay, thank you very much, Dr. Jarvis, for that answer. Charlie, do you have a follow-up question you'd like to ask?
Sure. Just another sort of just thing I've heard anecdotally is that someone had thought that maybe there was some hesitation to test healthcare workers who may have been exposed to COVID-19. And I can't remember actually which hospital I heard this in regards to, but reluctant to, given the chance it might sideline them, they might have to quarantine if they test positive. I mean, is that any factor in when you're doing testing of workers, that there's a risk they might test positive and not be able to work?
I've not heard that, but I don't think any of us would adopt that.
That is part of I'm sorry, Steve. We were talking over each other.
We're all jumping in.
Part of our process. We would do that for whatever the condition was, not just COVID. We take healthcare seriously. We take infection prevention seriously. We do not want individuals working who are ill, and therefore, without knowing any specifics about what you described, that does not seem like any part of any of our practices.
It sounds to me like one of those medical myth rumors, and I phrase it that way because if someone thinks they're exposed to COVID and they want to test right now because they thought they were exposed yesterday, scientifically that makes no sense. You could take up to 14 days to become positive if you had unprotected interaction. That is, both of you are unmasked, you're in the same space for 20 minutes. Yeah, you could have it, but what you really should do is go home. But we wouldn't keep you at work if we thought you had high-risk exposure, nor does testing you on day one scientifically mean that you can work the next day. So it sounds like you might have some piece of information and misinformation that became confabulated, but if someone has COVID or we think they have COVID, they can't work with patients. It just doesn't make any sense.
Okay, thank you very much for those questions, Charlie. I do see that you're not last but least because TJ Tremble from Fox Bangor TV7 has joined on. TJ, if you would like an opportunity to ask some questions now, once your mic is unmuted, please do so. All right, looks like it's a little sticky. Hold on, TJ. Andy or Karen, can you help with that? Everyone's
Yeah, I think he has to unmute on his end.
Yep.
TJ, can you unmute yourself? All right, I'm going to try and unmute all. Everybody don't talk, and we'll see if we can get TJ up to answer his question. TJ, if you have a question, do you want to put it in the text window? Going once. All right, TJ, try one more time to unmute yourself. Well, it's technology, sometimes this happens. He's good. All right. This took a little longer than I think we anticipated, but obviously we had a lot of interest from members of the meeting, a lot of participation. Thank you very much for all the members of the media that joined us here today. Let me thank all of our presenters, Dr. Jarvis, Dr. Alexander, Dr. Diaz, for making themselves available for this time. Anybody have any interest in the Zoom recording, please let me know in the chat box window. I'll leave it open for a little bit to make sure that we hear your requests and that we will make sure to get that to you via email.
Thank you, Chris, and thank you for everyone that joined us today.
Thank you.
Thank you all.